We've been members of CAPC since 2015, and we realized that we had access to many educational modules and opportunities, but we also realized that it was being very underutilized. So when the Tipping Point Challenge came up, we thought this was a perfect opportunity to spread the word throughout our health system, not only for us palliative care clinicians, but also to other non-palliative care staff throughout the hospital and the health system, who, by the way, were asking for more palliative care education. Non-palliative care clinicians have responded overwhelmingly positive to the challenge and to the modules. They're very easy to use, they're pretty slick, and they also like the free CME and CEUs that it gives us. The steps that we took to promote this challenge throughout our health system was that first we went to administration to secure buy-in and to secure their support. We then went to the education department, and they included it in our e-modules and our net learning on our intranet page. We actually made one of the modules mandatory, and the rest of them were highly encouraged. We started with the communication modules because we thought that that would be the most universal to any discipline throughout the hospital. And the mandatory one was the delivering serious news. So once people started with that one, they realized how much they learned from it and how easy it was to use, and many people actually went on to complete other modules. We advertised through going to department meetings, to physician leadership meetings, and also through email blasts, and then through word of mouth. And we incentivized the challenge by offering a competition between departments, and whoever completes the most courses and earns the most designations by the end of 2019 wins the competition. The mandatory course was implemented across the hospital in general, so physicians, advanced practice providers, nurses, social workers, case managers, respiratory therapists, and pharmacists. Those are the clinical folks who have to complete these net learning modules, and so we just incorporated it right into that system. The feedback has been very positive. I think it's too early to tell to see if people are using the skills they've learned. However, we have had several physicians and nurses pull us aside in the hallway and say how much they enjoyed it, and I have the feeling that they'll be able to use these skills in their everyday practice.